Rib injuries in Jiu Jitsu are very common, often from direct trauma to the chest wall. I'd like to give you a short practical guide. First, let's take a look at the body organ systems and layers. Whenever you suffer an injury, it's important to think of the body structures in terms of layers. Initially, we have the skin. Underneath the skin, several layers of muscle. Of course, then we have the breastbone and the ribs. We have the lungs, one on each side, the heart with all the blood vessels, and the nervous system. You can see there's a nerve that follows the course of each rib. If you suffer an injury and you're having chest wall pain, the first thing to do is always look at the skin. A cut, scrape, boil, pimple can easily explain pain in the area. Then think about a muscle strain. Did you pull a muscle, tear a muscle, especially a pec muscle, etc.? The ribs themselves, there are 12 pairs of ribs, left and right. The first 7 ribs are sometimes referred to as true ribs because they connect directly to the breastbone, the sternum. Ribs 8 through 10 connect to the cartilage of the rib above, as in this example. Ribs 11 and 12 are sometimes referred to as floating ribs. You can see they connect to the spine and float. There are 2 main types of rib injuries. You can have a contusion where the trauma results in blood leaking and fluid leaking from the direct trauma around the rib, which then can be very painful for weeks because it irritates the nerves that follow the course of the rib. Another possibility, of course, is an actual fracture of the rib itself. You can also have a strain or tear of the intercostal muscles, which are not shown here. They run between the ribs. Trauma to the cartilage, sometimes called acute costochondritis, can be very painful. Symptoms of a rib fracture or contusion, bruise, can be pain with movement, breathing, cough, and this can last for weeks. Some practical tips for treatment. If you feel you've injured a rib, it would be a good idea to see your doctor and at the very least have a chest x-ray and a rib series performed. The rib series would look for any evidence of rib fracture. A chest x-ray, sometimes a rib fracture can cause a pneumothorax, which pops the lung on that side and it collapses a little bit. In medicine, that's called a pneumothorax. That can happen. If you're diagnosed with a rib contusion or rib fracture, of course, rest, icing 4 to 5 times a day, Tylenol, ibuprofen, but follow your doctor's advice. If you suffer an injury to the chest wall, always think in terms of layers of the body, and if you feel you've injured a rib, see your doctor, get a proper diagnosis, have a chest x-ray to rule out a pneumothorax, and a rib series to rule out a rib fracture.